This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.
We are so excited to have Thomas Perron joining us today. He's a board-certified nurse practitioner in psychiatry. Excited to find out more about the work he does and, more importantly, how he's helping people with so many different mental health concerns. So first and foremost, welcome to the show. How are you today?
Good morning. Thank you so much for having me. I'm doing well. Thank
Well,
you.
I'm excited to have you, fellow New Yorker, right? You're based out of New York City?
Yes, I've been practicing in New York City and Manhattan generally, but in Brooklyn and the Bronx for about 30 years.
Oh my goodness. Not to age myself, but you don't look old enough to be practicing for 30 years, but that's
Very
great.
good. Thank you so much for
You
being
are
so
so
kind.
welcome. Well, I'm excited to talk about psychiatry and what
Sure.
you're delivering and helping people with. But
Mhm.
before we get into that, I think it's always important for me to get to know you and vice versa. So I want to talk a little bit about, where you're from originally. Give me a little background of your family and,
Sure.
how do we get down this path of, wanting to help people in this, in this capacity?
Sure. It's a relatively unique story. I was raised here in New York as a kid. Both of my parents, my mom and my dad, are both nurses, so it was
Oh,
kind of the family business, if you will. My mother was actually very, very active and an advocate. She was the president of the Emergency Nurses Association here in New York when I was a kid.
ah,
So they part of service has always been a family business, if you will. And I really didn't have a calling for it until I got to a point where I had the opportunity to make a decision, and believe it or not, went to nursing school, and unfortunately for me, worked in one of my mother's emergency rooms, which was a very difficult thing.
oh,
Everybody was
wow.
kind of on me, but it was really there that I found where my niche was for psychiatry. I got pulled away from medical, and my interest really kind of got into the mental health area. And from that point on, I moved into psychiatry, and then came to New York to do training at Columbia University, and that's where I got my advanced training. And while I was working at the New York State Psychiatric Institute, and that was kind of my foray many years ago into practicing psychiatry as a prescriber, diagnosing and prescribing. And since that time, I went into the public sector and worked in community psychiatry. I've worked in shelters and clinics and community clinics and emergency rooms, as well as now I maintain a private practice. I was the director of psychiatry for some large agencies, where we basically took care of folks who couldn't access the system elsewhere. Psychiatry is a strange specialty. It's one that patients feel the need that they can and should reach into their pocket for care, which doesn't happen in many other specialties. But I think that speaks to a problem with access and consistency in mental health, particularly for folks who don't have resources to pay out of pocket. So the community psychiatry system here in the city is quite robust. However, as we talk about politics and such, you hear about benefits being cut and such, and what that means for mental health is that we're going to have the sociological consequences of a system under strain, because unlike most other places in medicine, psychiatry causes homelessness.
Hmm.
Not many other illnesses do. If diabetes or asthma caused homelessness, we would be treating them differently than we treat mental health. So I think that the larger part of why I got into the system was a matter of interest and curiosity, and then afterwards it became somewhat of a calling to
Yeah.
try to improve access and consistency for a larger set of patients. And I've bounced around a lot, and had a lot of experiences in addiction psychiatry and infectious disease consultation. And what I generally found myself more interested in is the community-based work. But now I'm old, despite my appearance, and I have now stepped back and I do some consultation for non-for-profits here in Harlem. Right
Wow.
now, I'm consulting with some agencies, but generally, right now, I'm providing comprehensive treatment in person and virtually through a private practice, treating children, adults, and adolescents in a comprehensive way to make good on what I've been shooting my mouth off on, and to try and allow access and consistency. And so that's the short sketch of where I am and how I got here.
Well, amazing. Thank you for sharing this. And I know you mentioned your wife. She inspired
Yes.
you to get, can you tell me a little about your family life
My
too?
wife is a
Hey.
wonderful girl. We went to high school together, and she wouldn't date me in high school, but she did afterwards. And when she has a PhD in molecular and cellular neurophysiology. She teaches at St. John's University and did training at Columbia. And it was one of the reasons that brought us up to New York. And in the context of her work, the incredible sacrifice and dedication that folks who have that scientific calling was really inspirational. And while we were at Columbia, I was working at Columbia, I was training at Columbia. My wife was doing her postdoc there. My son was born there.
Aw.
He went to school there. So we were kind of in a company store kind of a way, but it really did allow for me to feel like I could do it. Like many of us, we all have the fake it until you make it attitude. But when we have somebody who's strong and supportive next to us, who can guide us as a model as well, it helped me not stumble. And when I did, she helped pick me up and dust me off. Clinical training in psychiatry is difficult. It's not selling balloons, and not everybody is happy with what is going on around them. You get to see people in the absolute worst states that they're in. So having my wife around to
Aw.
help me get through training, and then also
Yeah.
to help me rebound after 30 years of of hearing, terrible stories. And hopefully with the interventions that we put in, we can change the outcome of those stories. And I think that psychiatry, because it's pervasive and it allows for folks to have a posture that allows them to pursue wellness in every other way, it becomes important. It's pervasive. It ties in through the entire human condition, and certainly my human condition was improved because of my wife was looking after me this whole time.
Aw, beautiful. Oh my
Sure,
goodness.
it's the truth. It's the truth.
Well, this is great. I love getting, the backstory to get to know
Sure.
you further. And now let's get into business and how you're helping so many. You mentioned you employ holistic, individualized, multidisciplinary approach to wellness. And you
Sure.
say the goal is really to support and improve wellness. So
Yeah.
let's dive in a little further, if we can,
Sure.
into, the three aspects that you wanted to kind of discuss for today, right? Providing the quality treatment, ensuring access, consistency, and let's get to some of the things that you're actually, helping people and you can help people with.
Sure. I think that one of the things about this system is we can look at it in many different ways. Psychiatry can be looked at in the molecular kind of cellular way. It can be looked at in the medication affecting a patient, and then the way that the patient affects the community, and then the community affects the system. So, in that spectrum, there's many different ways that any one of us at any level can intervene. I particularly like to intervene on the smaller level. So in providing access, that's I think one of the most paramount challenges is that when somebody is feeling depressed or anxious or has to establish new care, that it becomes very, very difficult to try and obtain an appointment. So establishing treatment with a provider not only is difficult because the person is in a difficult state.
Yeah.
They're not feeling well when they come to you. So just getting the appointment and getting them in the door so that we can provide some help is challenging. So in my office, we offer virtual visits and in-person visits throughout the days and evenings, early in the morning, to try and work around people's schedules. as well as to provide some availability that's not 6 months down the road, which is a typical issue when you call and make an appointment. They'll give it to you in November.
Yeah.
So in that setting, providing that kind of access is paramount. The second part to it, though, is as you mentioned, the holistic piece. Is
Okay.
that in psychiatry, I'm not in my approach. I don't just look and say, you're a depressed person, I'm going to treat you with this medicine to remove these symptoms. What we look at is a total picture of the person, because we need a total picture of wellness. And that includes social interactions, sleeping, eating, exercising, the quality of the quiet time that they have, the quality of the actual stressful time that they have, the ability to put someone on a firm posture, on a firm footing, so that they can go and deal with whatever life is rolling at them, even if they have to carry the burden of depression or anxiety or schizophrenia. Once those systems are put in place so that we can treat the symptoms, but then we look at how we can generate wellness. So
Okay.
it's not just a state of absence of
Mm-hmm.
symptoms. That's the beginning. So we get access, we treat the symptoms. Now we try to get the correct posture for wellness moving forward, for long-term sustained, maintained wellness. And that's the real challenge, to keep a patient engaged, to keep your community engaged, to make sure that there aren't those obstacles where insurance
Oh yeah.
won't pay for a visit,
Mm-hmm.
honestly, most of us, it's a very common thing. Many of my colleagues and I have similar issues with access.
Mm-hmm.
It seems that there is a tremendous demand, an ever growing number of patients trying to seek care, and the cost of care should never become an obstacle to treatment. And that's one of the basic tenets that we also operate off of here. And although we aren't in this to make ourselves rich, we do operate off of a sliding scale so that the cost of treatment doesn't become an obstacle to treatment. The idea about the logistics of scheduling and consents and insurance eligibility and co-pays and all that nonsense is secondary to what the real goal is what are we here to treat, and what are our goals towards wellness. And the idea that an extended copay or an unapproved visit, it does not stand in the way of us treating patients. We singularly look at the treatment goals for our patients as our primary motivating factor.
Amazing. Thank you so much. And just to kind of reiterate here, I mean, you're helping people with whether it's bipolar depression, you
Mhm,
mentioned schizophrenia,
mhm.
suicide prevention, anxiety, social phobia, PTSD, anxiety, OCD disorders. There's a lot
Oh
that's,
my goodness, and attention deficit
yes.
is one of the things that I find more frequently these days is during the pandemic. There was I think many people sought treatment during that time for a host of reasons: for depression, for anxiety, for distractibility, for the inability to maintain their focus and concentration while they were outside of the office. And that tracks diagnostically. Structure and schedule helps folks. So you could see where there would be a balloon of
Yeah.
people seeking those services. So you're right. There's a broad spectrum. We don't specialize in any one area, although I do have a great deal of experience after 30 years in post-traumatic stress disorder and depression and bipolar, schizoaffective disorder, schizophrenia, post-traumatic stress disorder, and attention deficit disorder. Every patient that I see for the past 30 years and moving forward gets screened for depression, bipolar, psychotic disorders, distractibility, and anxiety. And in those cursory evals, that at least lends us the idea where we can take our next steps in looking at what this patient might require. But we and many of us, but at my office, we treat just about everything that comes through the door. If we can't treat it, I have a colleague, I'm sure, somewhere in the city that will come in and lend a hand, and pick up a patient that might be too much or maybe too complex for us at my office.
Beautiful. Thank you so much. And let me also point out now, in your time here, you're also something else. You are a New York State certified medical marijuana provider,
Yes,
which helps all this. And could you just share a little bit about that? Because that's something
sure.
that people can benefit from too.
Without question. I've been an advocate for medical marijuana for many years, and in psychiatry, we were able to treat anxiety disorders. Specifically, originally was post-traumatic stress disorder with medical marijuana, and it was a complex system. You had to come in, get an evaluation, get registered, and then obtain your medicine, your cannabinoids at a dispensary. Now that it's legalized, it's a much different field, and the supply is safe and unadulterated. And I think is relatively well regulated. Not to the extent that dispensaries were, but I think that the supply out there is safe. And so one of the things about using weed to treat anxiety is this: it works great. It is something that will help people feel calm. It will help very, very acute onset psychiatric symptoms, anxiety symptoms, sometimes even a sense of paranoia or what's called hypervigilance. And so in the setting of using cannabinoids or medical marijuana, there's really a large gradient of very, very potent anti-anxiety features. The problem with medical marijuana and using even recreational marijuana, using it as an anti-anxiety agent, is that you can't really take an edible and then go to work, because we have a side effect. The side effect of medical marijuana and recreational marijuana is that it will make you very, very calm. It will treat your anxiety, but you will be stoned as a side effect.
Hmm.
So it makes it very difficult to go to work and do very technical work or data entry, or to not, let's face it, we don't want to be stoned at work. But in the context of this, outside of that obstacle, that medical marijuana actually produces less risk than many of the anti-anxiety medications that we prescribe as an alternative. There's a very low risk of addiction. In 30 years of working in psychiatry throughout all kinds of settings, I have never admitted anybody to the hospital because we had a marijuana overdose or we had to detox them from cannabinoids. And that's why I think it's been deemed safe and made legal here in New York. So I advocate patients to use it. And many times, if we can work it out in their treatment plan when it's appropriate to use, it sometimes can take the place of some of
Wow.
our other medicines that carry a little bit more risk. So I think it's wonderful that it became legal. It did kind of change my business model when I was doing medical marijuana evaluations when it became legal. Now I do a lot of consultation and teaching so that my patients know how to use the recreational supply. Although I do have some that still go to the dispensaries on a much more regulated basis. But I certainly think that it's a wonderful intervention that I continue to recommend today.
Got it. Well, thank you so much. And there's still so much more to you and the work you're doing. And what else for today, being it's our first show together, do you
Sure.
want to make sure we cover? Do you mind?
No, absolutely. I think that the plan is that I'm fortunate enough to be able to spend time with you every week, and so there'll be lots to discuss.
Oh,
Um,
great.
in the context of wrapping up today was really, and again, I'm trying to quell my fan my fan interest of you, in saying that, to come in and to be able to have the opportunity to shoot my mouth off in a larger way, to have a platform to be able to speak about things that I think some folks roll their eyes when they come to dinner with me and they know I'm going to go on about social justice and access to care and the improvement in
Mm-hmm.
systems and patients and such. But to be able to actually say that to an interested audience and to have that spread, maybe it lights up somebody to seek treatment, or maybe it educates somebody so that they can help somebody else in their world. And a little bit of fun and a little bit of learning is always welcome. And even if we can plant a seed so that somebody learns something from me droning on and on, so that even sometime in the future they may be able to know how to access a very difficult system, then I'll be satisfied. But I do look forward to moving forward and talking about the entire gradient of all these things
Aw.
from beginning to end.
Oh my goodness. Well, thank you so much. And,
Sure.
I love this because mental health and wellness extremely important. Let me just
Mhm.
ask, you've been working in psychiatry, like you said, for almost, like 30 years, right?
Mhm.
So you were doing inpatient settings, emergency
Yep.
room, addiction services. There's a lot. Can I just ask, what has been happening and change? I just feel like since the pandemic, so
Sure.
many people's mental health conditions got worse, or were they just more aware of it because everyone started talking about it? Finally, everyone in the world was on the same boat, dealing with loss, dealing with the unknown, dealing with, that's where I feel like I started hearing the word anxiety, anxiety, stress,
Mhm.
stress more. What has changed? Did you notice that? Well, the past few years, what is different?
Well, I'll be honest with you. I think that you're exactly right. The stigma of seeking treatment is really no longer there. Somebody to say I'm depressed or anxious and to seek an appointment used to be a very challenging aspect. So I think that people are aware and don't have the shame or fear to
Yeah,
access treatment. So, but to track with your question, that the pandemic created
yeah.
a massive global,
Oh,
at least here
yeah.
in the city, particularly, we were hit particularly hard.
Oh,
We had, sidewalk morgues, right, at our hospitals here. The streets were empty, the stores were empty, and nobody could go to restaurants. And if um, somebody were to pull the rug out of anybody's world like that, and on the top of the idea that there's a deadly virus floating around, so stay inside, that's enough, I think, to
mm-hmm,
to rattle just about anybody. But if somebody is maybe susceptible or has a history of
mm-hmm.
anxiety, that's enough. That's going to light that up. And I think that was in part and parcel why we saw an uptick in seeking treatment. The
Sure
other piece,
did.
though, I think is exactly right, what you said about that people didn't realize it. That I think that there was a realization that now we were forced to be socially isolating. We weren't interactive. We weren't outside, so we were less active. Um,
Yeah.
we may have even had changes in sleep and appetite. We were all self-directed at our computers. And when we put all those things in line, if we were to look at that diagnostically, uh, social isolation, a change in
Yeah.
sleep, a change in appetite, a sense of not direction, maybe some anxiety, maybe a low mood. Now we're that almost trends towards the diagnostic criteria for a depressed episode. And that would be a normal response to a very difficult situation. So I think if we look at a city of 9 or 11 million people just in our little microcosm of New York City, even a small percentage of 11 million people is a lot of people that need care. And I think that was one of the things
Yeah.
that springboarded mental health into the forefront. The other piece to it as well was the expense of it. The other news story that spun out of that was that lots of people were accessing care, but the amazing cost of that care was also the tail end of the consequence that I think we still, years later from that event, still struggle with.
Got it.
As we see the politics of healthcare being played out, and I think that also dovetails in on the problem that you identified that started certainly was exacerbated during the pandemic.
Now, let me just also ask, you're doing virtual telehealth appointments with
Yes.
people as well. What
Mhm.
states are you allowed to work in?
New York. I worked
Okay,
throughout New York.
perfect.
Yeah.
And in our last few minutes together, what else do you think is important for people to know about you and your practice?
You know, about me and my practice is that hell or high water, we're going to treat you. We're going to find out what it is that you need. And if we can provide it for you, we'll provide it for you. And we do it well. We provide very comprehensive treatment, and the goal is wellness above all else. If there's something that comes along that we need help with, I have an extensive and robust collection of clinicians that I've worked with over the years, from therapists to psychiatrists to MDs and primary care specialists. And so the idea is all-encompassing or enveloping assessment and comprehensive care that will include
Yeah.
primary care, multiple people, family members, everybody together as a all hands on deck. And that's essentially, I think, what anybody who contacted my office should expect. And if they didn't expect it, pretty quickly they'd learn that we're kind of full press, and we want everybody to be involved.
Good. And you do accept some insurances, correct?
We accept several insurances.
Okay, good to
Right
know.
now, I don't accept Medicaid, but it's Oxford and Aetna and
Okay.
Cigna, Oscar. My website is
Perfect.
tperronpsychiatry.com. And I also work under a few different platforms, Alma and Rula, and on ZocDoc. Most patients can find my panel there, and that would be the launching off point to request appointments, regardless of what platform we use. And I accept the same insurances across those platforms. I do work on a sliding scale for out of pocket, because if somebody comes to me and there's an insurance snafu, it's not going to stop us from treating them.
Beautiful. Well,
So
that's
yeah,
good to
we
know.
essentially, anybody who needs help, who reaches out to us, whether we take their insurance or not, is going to get our help, get our assessment, and maybe a referral, or maybe we engage in treatment on a way that can make it accessible for the patient.
Beautiful. And one more time, tell us that website, how we can contact you, please.
Sure. You can, my website is Perron Psychiatry. That's T and my last name, Perron, psychiatry.com. It has some information about us, and there's a book online feature for which will take you to a calendar that you can look at appointments. I have virtual appointments throughout the week, generally starting in the morning until 9, and then I see patients in person on Saturdays.
Beautiful. Well, thank you so much, Thomas. Pleasure getting to know you, and looking forward to our next few shows together. Thank you again.
Absolutely. My
You
pleasure.
have a
Thank you so much.
fantastic day, and we'll connect soon. Thanks
Thank
again.
you.
Bye-bye.
This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.